All right, concerns about future tariffs on prescription drugs from people dependent on those drugs to live. So right now, about 90% of prescription drugs are generics. Half of those are made in India. The Trump administration excluded foreign-made prescriptions from tariffs, but there are worries that those could come in the future. So CBS News reporter Andres Gutierrez is live in Las Vegas for us. Thanks so much for joining us. Let's talk about what these tariffs could mean for people dependent on prescription drugs to manage their health conditions.
Well, Liz, you can bet that if tariffs were to be implemented when it comes to pharmaceuticals, it would raise the price of medications. Like you said, generics, a big portion of what Americans end up going to the counter with and asking for at the pharmacy. About half of those, you said, come from India. The country itself makes about $9 billion each year in exporting those generic drugs to our country. And so some pharmacists are worried that because prices would go up, some of their patients would have to ration their medication or skip their dose, and that may end up creating some serious health complications like strokes or making their health conditions even worse. There's also those folks that live on a fixed income and can't already afford for medications. One of those individuals is Marcia Cook, who lives out here in East Las Vegas. She says she isn't sure of the promise that President Trump has made of this short-term pain leading to a long-term gain.
I'm hoping that he knows what he's doing. But until then, I want to know from him, what are we going to do? Until in the long run, when it all changes, what are we supposed to do? Who are we supposed to go to? I mean, there's organizations that can help, but there's so many people that needs help.
And one of those organizations is a nonprofit called Care Chest here in Las Vegas. They also have a location out in Reno. They help out folks with medical supplies and covering prescription costs. We'll give them each year about $300. But as Marcia said, there are so many folks out there who need the help, and there are limited resources. And so at this point, they're just hoping that the Trump administration doesn't have to dole out these tariffs specifically when it comes to pharmaceuticals.
Yeah, if the administration does move forward, though, and have to add tariffs on these pharmaceuticals, then how do they prevent drug shortages?
Well, right now, they haven't been specific about that. The plan right now has been unclear. This administration has kept a lot of folks on their feet. Last week, they were dangling the fact that these tariffs would be coming for pharmaceuticals. And then when Liberation Day came about this week, that did not transpire. However, the drug industry has been advocating in a slow rollout of these tariffs, not the 25% that the president would like to see implemented. So hopefully they could try to kind of piecemeal it throughout over weeks or whenever these negotiation tactics, if they are being used like that, will transpire. They're also pointing out that the Trump White House could exempt certain medications, so some antibiotics, some other medications that may deem necessary, they may be excluded from this tariff. So again, we'll see how all of this ends up shaking out.
Andres Gutierrez, thank you so much. Andres will also have more on the concerns over prescription drugs tonight on CBS Evening News.